Welcome back to my channel. So today I've come up with a topic which is pelvic inflammatory disease. So this is a condition which can happen in females basically. So let me give you more details about what exactly is pelvic inflammatory disease, what are the symptoms, the risk factors, and how to diagnose this if you are suffering from this particular issue. So pelvic inflammatory disease, so it is an infection that can happen in your reproductive system basically. So we know the reproductive system in female, it includes the uterus, the fallopian tubes and the ovaries. So these are the organs which are mainly involved in the reproductive system. Okay, and any infection in any part of this, whether it is uterus, fallopian tubes or ovary, can lead to pelvic inflammatory disease. So there can be infection, there can be inflammation, there can be pus formation. So these are the usual things that can happen. So because of this, it can lead to blockage of the system. So there can be blockage in the fallopian tubes. There can be some pus formation in these areas, which can lead to issues. So according to a little statistics, in 2013 itself, approximately 88,000 women in the age group of 15 to 44 were suffering from PID. Okay, so this happened in US. Similarly, it can happen in anywhere, any place. Okay, so sexually transmitted infection. So this can happen because of improper sexual procedures also. Okay, so a sexually transmitted infection. So usually organisms can enter during this process, which can lead to this infection. So this can lead to complications usually, like people may not get pregnant because of these infections. They can have problems related to pregnancy, as I told you, and even they can have a lot of pelvic pain. Okay, so this is the major issue during this particular situation. So as I told you, it is a sexually transmitted infection. So the usual organism which is causing to this infection is gonorrhea and chlamydia. So these are the two organisms which are commonly seen which causes this infection. So this is just to show you how a normal fallopian tube looks like and how a inflamed fallopian tube looks like. So this indicates that there is inflammation, and the inflammation is because of infection caused by the bacteria. Okay, so these are the common ones which are causing this problem. So this is usually transmitted because of sexual transmitted disease, as I told you. And one more reason for this can be douching. So what exactly is douching? Usually a cleaning of the vaginal area, we do it. But this douching is a situation where you try to wash it too much. Okay, so cleaning the vaginal region too much using water and other mixtures can lead to an issue where your good bacteria, which are usually required to keep a balance in the vaginal region, those are lost. So because of these good bacteria which are lost because of too much douching, it can lead to more complications. So no doctor will recommend douching, and no nurses also will recommend this douching. So too much douching is not good, which can lead to complications. So coming to the physical symptoms, you can have pelvic pain, as I told you. This usually happens in the upper right abdomen, and you can have a lot of vaginal discharge with foul smelling. So this is one more indication that you might be suffering from this particular condition. You can have unusual bleeding. So during sex, you may have this bleeding, or between the periods, like your period is not through, but still you have some unusual bleeding in between. That might be a reason because of this infection. You can have fever with chills. You can have painful urination because of inflammation in that area, and you can have irregular periods. So these are few physical symptoms which can happen because of this particular situation. So when should you see a doctor? So if you have issues with getting pregnant, or you have too much vaginal discharge, which is foul smelling, and you have thick discharge also, or watery discharge, anything of discharge which is not normal, then it's better you consult your doctor. So that can be an indication of infection. If you have severe pain in your abdominal region, you have fever, you have foul smelling discharge, as I told you, and you have vaginal bleeding or spotting, not during the normal menstrual period, but some other time. So then it's better you consult your doctor, and that is your gynecologist. So coming to the causes, as I told you, the organisms, the bacteria which are usually causing this infection is gonorrhea and chlamydia. So unprotected sex can lead to this transmission. So it's better to have protected sex. And coming to the normal barrier, as I told you, good bacteria which are lost because of douching, it's better to avoid that. And certain times because of intrauterine devices, also it can lead to this condition, because For long-term birth control, a lot of intrauterine devices might be used, and during this medical procedures, there's a chance that there can be infection. So these are few causes which can lead to this problem. Other risk factors may be becoming sexually active at younger ages, having multiple sexual partners, or being in contact with the person who has multiple partners. So in this way, risk factors can be these, and douching, as I told you. So these are the few reasons and risk factors which is leading to this complication. So more complications, like it can lead to ectopic pregnancy. So pregnancy, we know that when a lady is pregnant, the what do I say, the implantation happens in the uterus. But if there is a chance of complication like this, then during the pregnancy, the egg gets implanted in the fallopian tubes rather than the uterus. So that is called as ectopic pregnancy, which is a complication. Apart from that, it can lead to infertility problems because you do not have a proper system there. There is inflammation, infection, which can lead to infertility. You can have pus, as I told you, because of infection. There can be chronic pelvic pain, and it can be life-threatening if it is not treated. So how can you prevent this? As I told you, practicing safe sex, getting tested, which is very, very important, and requesting your partner also to get tested in case you are having this issue. Maybe the infection is from the person, and not douching, and definitely staying away from alcohol and drugs, because this indirectly might lead to sexual assault, and that can lead to possible exposure to sexually transmitted infections. So coming to diagnostic options, as I told you, gynecologists can help you out with this particular situation. So they might do a normal medical history. They may ask you about your medical history. They may check for the signs and symptoms. So basically they do a pelvic examination, something like this, to check the normal flora of that region and to check if there is any inflammation in that particular region. So apart from that, they may even suggest few lab tests. So basically urine test and blood test might be recommended to check if there are any WBCs, infection. So during infection, what happens is the WBC count increases. So to check if there is an increase in WBC count, they may recommend a blood test. They might certain times recommend even an ultrasound to check the internal organs if there is any inflammation. So as I told you, there was an inflammation in the fallopian tube that can be checked during the ultrasound. Similarly, if ultrasound is not giving very good understanding, they may even do a laparoscopy to check the internal organs by a small incision. And certain times they may even recommend a endometrial biopsy. So these are the few diagnostic options which are recommended by gynecologists based on the needs. So how can you treat this? So definitely if it is not treated, it leads to infertility issues. It might lead to ectopic pregnancy. So this is just to show you ectopic pregnancy. So as I told you, the egg gets implanted in the fallopian tube rather than getting implanted in the uterus. Okay, so this is a complication which can lead to problems and you're not getting pregnant. So this is happening continuously. Even if you're trying, it is not happening. Maybe this is one reason because you're not getting pregnant. So it's better you go and test with your gynecologist. So coming to treatment options, we know to kill bacteria, we have something called as antibiotics, which are very suitable for killing the bacteria. So now based on the lab test, you can actually identify, okay, so even you can do culturing of that samples. Basically maybe your what is that, white discharge sample. From there you can get the organism isolated and then you can plate it, and this will be done in the diagnostic labs and they will tell you which organism it is mainly causing this infection. Based on that, a suitable antibiotic can be suggested. Okay, so that can be a good choice. So once you take this antibiotic dosage, so they may recommend it for like 4 days, 5 days, whatever it is, and the particular dosage, see that you take it for that particular time, because sometimes we have seen that patients get better in 1 or 2 days and then they stop the antibiotic dose. But this is not recommended. You should take the dose till the recommended time, whether it is 4 days, 5 days or 6 days. Okay. So based on that, take the suitable antibiotic dosage and see to it that you come out from this particular situation. Otherwise, one more option is treatment even to your partner also. In case you are having this repetitive infection, then it's better your partner also gets tested and he also gets antibiotic treatment. So coming to one more thing which is important here is avoiding sexual intercourse during this treatment, because you're having this infection, you're undergoing treatment using antibiotics. It's better to stay away from this sex during this time. So that is how you can save yourself. Okay, so coming to the takeaway messages, we have seen that how we can identify this particular situation, how douching is not good, and because it loses or it upsets the balance of the good organisms versus the bad organisms, which is causing this infection, and how insertion of interuterine devices can lead to complications. So it's better to get tested and better see your gynecologist so that you avoid this issue of this particular situation. So don't forget to take care of yourself. This is what I want to tell you today. So these are the references. So thank you for watching. Do like my videos and do subscribe to my channel. If you feel this video is worth sharing, please do share to all your family members and people you feel that it's worth watching. And thank you for your support. Have a nice day.